Well, there's some positive news coming out of the Comoros, though. Health authorities believe the 3 islands of the Indian Ocean archipelago are on the cusp of becoming declared malaria-free. Until 2004, the Comoros was ranked among the countries worst affected by malaria. But this has changed. Let's take a look.
It's taken healthcare workers 10 years to be able to confidently declare that malaria is no longer a threat in the capital, Moroni. The Comoros launched its first anti-malaria drive in 2005. It targeted early treatment, prevention and the widespread use of treated mosquito nets. But its success is mostly attributed to the treatment blitz of Arctic, a combination drug therapy derived from a Chinese plant.
Mass treatment has caused malaria to disappear completely. Now we don't have any malaria patients anymore.
The eradication of the mosquito-borne disease is a huge accomplishment for Comoros' 800,000 inhabitants. All that remains is sustaining the achievement and awaiting certification from the World Health Organization. With the backing of a team of Chinese practitioners, a new anti-malaria campaign set to run until 2018 has already been launched.
Our goal is to cut the chain of transmission. We did it in Anjouan. There have been no new cases since 2014. We did the same in Moheli. There have been no new cases since 2014 either. Which leaves us in Ngazija, where we have a few cases. We want to increase our surveillance on the 2 other islands, but also increase our focus on Ngazija so we can cut this chain of transmission before the deadline of 2020.
Malaria can be fatal if not diagnosed and treated early. The World Health Organization says 214 million cases, mainly in Africa, were reported last year. There is currently no vaccine for malaria. Jane Kale, CCTV.
Well, let's get more news on this now. And joining me is Dr. Bernhard Ogutu. He's a Chief Research Officer at the Kenya Medical Research Institute here in Nairobi. Dr. Ogutu, thank you for joining us on Africa Live. Comoros about to be declared malaria-free. What is it they did right?
Thank you very much. I think there have been a number of countries slated possibly to be declared malaria-free. And I think it's basically the main thing that drives all this is the commitment at the political and the government level that they have an issue and they want to solve it and commit resources to it and sustain it for that period of time. Because even now that they are moving toward the brink of being declared malaria-free, they'll continue funding their malaria program to ensure that they don't get reintroduction of the disease. And that's where it's a difficult thing that you have to continue pumping resources despite not seeing any cases being found in your country, because so long as the countries around them, like the African countries, still have the disease, they still stand the risk of reintroduction. And being an island, that's now they have to monitor their border to ensure that there's no that reintroduction, because the vector, which is the mosquito, is still found in the island.
Right.
So they just need to get somebody with parasites hanging around there, then you introduce the disease.
And of course, that reintroduction, as it is as worrying to the Comoros Islands as all the other neighboring countries, and many African countries have been trying to get rid of this disease for a while. What are some of the lessons, though, that other African countries can gather from the Comoros and the Comoros experiment?
I think one thing is that people, skeptics will say that this is an island, so it is easy possibly to eliminate malaria from that island. And when you're dealing with a bigger mass of land like the continent of Africa, then that's a different ballgame. But I think what we can learn from this is the commitment that the government has put in place to move from where they were barely less than 2 decades ago to where they are, where now they're more or less almost being declared, is the commitment and committing resources. They don't have that much resources. The economy is not that great. But you can see with committed resources and targeting their use of the human resource and the monies they have, they can achieve what they have achieved within that period of time. So it's something that calls in for a change of mind and accepting you have a problem and you invest in it.
And the whole question of resources is one that is quite a concern for many African states, though. So what support is needed for those African states that are trying to also eradicate this disease, and what challenges lie therein?
I think the challenges, one of the challenges that lie in for the African countries is that they need to look at this not as just as a country, because if Kenya goes for it, so long as Uganda is doing, if Uganda is not doing that, the same to Tanzania or South Sudan, then we are not going to make it. We need to look at it that we need to start shrinking this map of malaria as a continent, as a group of countries, and we should all go for one strategy and say that we are committing this and we have to go for it for a long time, because it is not going to be a short walk as such.
So what are some of the measures, though, that are being recommended, you know, by World Health Organization or other bodies? What are some of the measures that are being recommended for countries to adopt in order to effectively combat this disease? And are these being adopted, though, by African states?
I think one of the major things that have not been done properly and done well is purely surveillance, to know the burden of disease you have, to know where it is happening and what are the dynamics of the disease. That's something that we are now trying to see countries adopting, to have the surveillance program running pretty well. But the traditional interventions that we have, which are treatment with the appropriate effective drugs, use of insecticide-treated nets, and indoor residual spraying, are all activities that are being done. They are not being mounted on large scale. Like indoor residual spraying is fairly costly, and it's not being done on large scale in most of the countries across the region. But drugs are available, but a number of places that are still not available throughout. You still have stockouts, and that possibly, when you have stockouts, then you just end up having an increase in the burden of the disease. And then the distribution of insecticide-treated nets need to be sustained and maintained. You replace them after 3 to 4 years, and that needs to be maintained throughout. And I think at times these are lapses, and this currently is heavily dependent on donor funding. And you see, that is not something that you can go on with, and I think we need to start absorbing these costs ourselves as African states and possibly move with it. And I think that's one of the things that we need to do. I think currently we are still waiting for the patient, which means we are waiting for the parasite to come with the patient to the facilities. It is high time we start going for the parasites in the community. And I think that's where you can say you are moving the battle closer to where you are possibly going to win. And I think, which means we need to make sure that people don't come to hospital. We should be getting them out in the community before they get that sick. And I think, but that will require quite a lot of resources and a way of changing our thinking of how the health sector service is being delivered.
Right, Dr. Bernard Ogutu, thank you very much for your insights on malaria.